state. I've been in nursing for about 14 years now, and I started as a nursing assistant. Then I became a registered nurse, and then I went to grad school to become a family nurse practitioner. When I was a registered nurse, I worked in surgical services. So I basically was in the admitting phase where we got patients ready for surgery. I worked in the operating room where I was a circulator. I would also function as a scrub nurse and a first assist. And then I also helped take care of patients after their surgeries were over. Um, I love working in surgeries, but one of the things that I really miss was that patient interaction, which was one of the reasons that prompted me to go back to grad school and become a family nurse practitioner. And I've been practicing now for about 6.5 years as a family nurse practitioner. And I have to say, it's probably one of the best decisions that I've ever made. So yeah, I'll go ahead and I'll pass it on to the next speaker.
Hi, everyone. My name is Cecilia Valdez, and I'm a registered nurse, a master's level registered nurse. My master's is in healthcare administration. I've done a little bit of case management, but I really like Michelle said, I really like that bedside interaction. So I've kind of just stayed bedside, and I've done a little bit of everything. I've done PACU, nurse. I've also done OR nursing, I've done telemetry, and currently I'm working as a travel nurse in New York. I've been here since the pandemic started, and I came here and I haven't left New York. I'm still here. I'm originally from Arizona, and that's where I did all my past nursing, but I'm really enjoying this travel nursing right now and looking forward to doing it for a while more before I decide what my next step is in nursing. And then to the next person.
Can you guys hear me okay?
Yeah.
Yes.
Okay. So my name is Rebecca Mortimer. I am a board certified family nurse practitioner. I've been a nurse for March will actually make it 9 years since I've been practicing in the state of Florida. I became a nurse practitioner in 2018, and I've been working as a nurse practitioner up until this point. But like Cecilia mentioned, I'm one of those nurses who went ahead and took advantage of traveling right now. So I have been doing some travel assignments. Currently, I'm a part of the vaccination team in Florida, so I am doing vaccination for COVID-19. I have a background in medical surgical nursing. I've done med surg for about 5 years and did postpartum for another 4. Those are my 2 specialties. Outside of nursing, I am the co-founder of a platform called Executive Nurses League, which is a platform that is catered to aspiring nurses, current nurses, and nursepreneurs who are in transition to tapping into the best version of themselves. I'm a wife, I'm a mom of a very energetic 6-year-old daughter, and I'm excited to be on this platform with you ladies.
Thank you so much for sharing, guys, and I really appreciate you guys being here, so thank you. So let's get started. So our first topic is becoming a nurse.
All right, so that's my slide. So becoming a nurse, before I begin, I just want to say, and I may have some bias, but nursing is such a great field to get into. And as you'll hear a little bit later on in this conference, there's so many possibilities of what you can do with your nursing degree. So yeah, it's a great decision. But for the people who are interested in becoming a nurse, what are some of the things that you should do when you make that decision? One of the things that I recommend is, talk to a nurse or shadow a nurse. That way you have a clear understanding of the role of a nurse. Nowadays, I watch TV and there's all these nursing shows, and it doesn't quite depict what an actual nurse does. And sometimes they kind of fantasize their role a little bit. Nursing does take time. You're dedicating, years of education and then practice. So you do want to make sure that you have an idea of what you're getting yourself into before you actually do it. So So as soon as you realize, yes, nursing is for me, the next step that I would recommend is try to get some hands-on experience. Nursing programs are getting pretty competitive. I know that when I applied to nursing school, a long time ago, it was competitive then. So I can imagine that it's still competitive now. And you want to do everything you can to stand out on your application. And one of the things that's really going to help you stand out is getting that hands-on experience. I recommend volunteering. That's a really good route to go to, but just know that not all experience are equal. For example, if you were to, work as a receptionist in a medical clinic, yeah, you are getting some medical experience there, but if you volunteer as a transport in a hospital, it's going to look much better on your application because you have more of that direct patient care experience that these programs are looking for. The other thing too is you can always consider becoming a nursing assistant. These programs typically take about 3 months to complete, but I know that they do have accelerated programs where I think you can take like 4 to 6 weeks or so to complete. And just having that certification again makes you look really good as an applicant because it shows that you're dedicated and this is what you want to do. And then the other thing too is start looking at potential schools and programs that you're interested in applying for. A lot of times, they'll have talks where they go through like the prereqs, and they'll also give you tips and what they look for in an applicant. That way you have an idea of what you should try to strive towards through. If you're still in high school, there's a program, I don't know if it's all over, but in Washington State, there's a program called Running Start, which basically offers college classes for juniors and seniors. And the nice thing about this program is that you can take college courses for free. And so I would recommend, do those, complete some of your prereqs because it's free, who wants to pay when you can get it for free. And then the other thing to keep in mind too, at this time when you're completing your prereqs is that grades are very important. So you do want to make sure that, you're getting the highest grade as possible. And if you see that you're not getting the best of grade, you may want to consider retaking that class again, just to make sure that you're looking like a more desirable candidate on your application. So we'll go ahead and go to the next slide and talk about different nursing specialties. As I mentioned, once you get into nursing, the possibilities of what you can do is endless. I mean, you can work in a hospital as a hospital nurse, and of course, in the hospital, you have like your emergency department, your ICU, you have labor and delivery, you have med surg, you have psych, you have oncology, you have peds. So these magnitude of like fields that you can choose from. And if working in a hospital isn't your thing, there's outpatient clinics that you can work at. You can do school nursing, you can do flight nursing, you can do travel nursing, which I hear is amazing. So yeah, and you can do concierge nursing. And if you get into nursing and you're at the point where you want to do like more management stuff, you can become like a nurse manager, you can work in admin, you can become like a legal nurse, you can even become like a nurse consultant. And then there are advanced where you are going to need at least a master's. And under the advanced nursing, you're typically looking like at a nurse practitioner, and under that nurse practitioner umbrella, you have your family nurse practitioner. You can be a pediatric nurse practitioner. You can, be an adult geriatric nurse practitioner. You can be a mental health nurse practitioner. There's also midwives. There's nurse anesthetist who works in the operating room. You can also become a clinical nurse specialist where you specialize in one area, or even be a nurse educator. And then for those who have a passion with research, you can definitely go and get a PhD and work in research. Again, these possibilities, once you get that initial nursing degree, is endless. So that concludes my 2 slides that I was going to talk about. So I think Cecilia is going to talk about the next slides. Oh, Cecilia, I think you're on mute still.
I'm sorry. All right. So my topics are going to cover applying to nursing school and that process. I would say the first step into applying to nursing school is always explore the nursing career. Like Michelle said, it's so important to make sure that your whole heart is in this, because it's not, it's not an easy career. It's a very rewarding career, but there's going to be good and there's going to be bad. So like she mentioned, I would totally consider following somebody, talking to other nurses. Maybe right now with COVID, I know it's kind of hard to follow anybody, but definitely find yourself a nurse mentor that can explain to you what their day looks like. And if it's something that you really want to explore, like she mentioned, becoming a CNA, I think you really get to work with nurses hand on hand and really get to see what it looks like inside of the hospital for you. And so then you're not going into nursing school and then realizing it's something that you're not interested in later on. So it is crucial to do your fair research before you make this decision. And I think this goes for any career, really. Sometimes we change our minds. And so I think it's good to explore the nursing career before going in. Step 2, I would say, determine what nursing program you want to enter. There's several different programs. There's an associate's program, which typically takes about 2 years, and it's typically something you can do in a college setting. Then there's a bachelor program that takes 4 years, and usually you do this in the university. I know now they have the combined programs where you can do your associates in the college, and then you can do your bachelor's through the university online. So that actually cuts time. Your prereqs, I think, take anywhere between 1.5 years to 2 years. And then your program, when it's combined like this, and I think you also save yourself some money by going to the college and the university separately. I think it takes about another 2 years to graduate from these programs. After your prerequisites. And there's also the programs that are fast track that you can do through the university. If you already have a bachelor's in something, you can go straight in. I've heard that they're as little as 1.5 years to 2 years for these fast track programs, and you graduate with your bachelor's in nursing. Some programs even have masters. So there's a lot of programs depending on the state that you're in. I would totally explore these programs before making a decision. Don't just look at one program. Look at different programs, interview different programs, and see which one is more fitting for you. After that, after you research the program, you pick one, make sure you look at the requirements. What does the admission process look like? What deadlines must you meet? What prerequisites are required? And is there an entrance exam? A lot of these programs, most nursing programs do require an entrance exam. I know that when I went into nursing school, I think they had a HESI. I believe that's changed. I'm not sure what the entrance to nursing exam looks like right now. Then once you pick a program and apply, keep in mind that programs are very competitive. Sometimes you might not get in the first time. Don't be too hard on yourself. Just like Michelle also mentioned, make sure that during those prereqs, you're keeping your grades as high as possible. I know for myself, I had to take one of my biologies over again because I think I graduated with a C, and I knew that that was going to kind of hinder when I applied for nursing school. So I did retake it and ended up getting an A in my AMP2. And then once you're accepted into a program, you begin your journey as a nursing student. And that's a whole amazing time in your life. It could be stressful, but it's also fun because you create so much great friendships. Some of my best friends are actually from nursing school, And I think I'm ready for the next slide, preparing for the Nclex exam. I would say you start preparing for your Nclex exam the minute you go into nursing school. I wish somebody would have told me this when I was in nursing school, but I remember maybe a semester in, I was struggling a little bit. So somebody's like, you know what, just buy yourself an Nclex prep book, I think it was a Kaplan, and start reviewing it as you're going through the topics in school. So read the chapter and then start doing questions while you're in the, like, let's say endocrinology topic in your school. And that really helped me understand the question. I think Nclex is something you definitely have to prepare as you're going to nursing school and not try to understand the questions last minute. Plus, there's a lot of things that the school does to make sure that you're understanding those questions and the way that those questions work. You must identify your study style. We all learn differently. So make sure that you know how it is if you're a visual learner, then you can do something more interactive. Or if you're reading, if you're like good with reading and doing questions, then that's another way of studying. You just have to identify that study style. Make a study plan. It's crucial that you commit. I would say the way that I studied for Nclex is that every day I knew I was going to do 50 to 100 questions, and I would complete those questions and then I would review. It's very important to be intentional with your study time while you're preparing for your Nclex exam. Invest in resources. I believe that, there's a lot of different programs out there like Kaplan, UWorld. I would invest depending on how much money you have to invest. There's different programs out there that you can invest in. Practice questions, all kinds of questions. That's really the key to understanding, and then going down and understanding why you got the question wrong. And then making sure you review that question, go back to it in a week, and then go over it again. Stress management is necessary. It's about balance. Take some time for yourself. Don't just sit there and read and do questions all day long. Take time to do something for yourself, either exercise, make sure you're eating right, make sure you're doing things that are good for your mental health, because if you're stressed out, you're probably not going to do as well as if you were a little bit more relaxed. And lastly, believe in yourself. You deserve to pass. You completed nursing school at this point when you're taking the Nclex. So you know what you're doing. You just got to breathe and just study. I am ready for the next things to consider before going into nursing. Like I said before, nursing is not an easy profession. It's a beautiful one, but definitely not an easy one. It's in a span of one day, you can do so much. Either you're working with births, or you're working with deaths, or you're charged with making big time decisions for your patients. It just depends really on what setting you're working in. So I would say memory is everything during this time. You have to really just make sure you stay organized so you remember what you're doing. As far as for me, I do checklists to remember my tasks. Also, self-care is so important. Knowing how to learn from your mistakes. You're never going to be perfect, and you should be able to take constructive criticism when you're a nurse. This makes you a better nurse to be able to take that. Know how to defend yourself. There's a lot of nurse bullying that might be happening either from physicians or from patients or from other nurses. And you need to be able to stand your ground and know how to speak up when you see something that is wrong. And lastly, you must know that nursing is a career that, you have to go in with your whole heart. And then I'll go over a day in the life of a nurse. Like I said before, you rarely get the same day twice, right? Working as a frontline worker means that you're always helping and interacting with patients first. And every single patient is different. Every single human is different. Every situation is different. While some are stressful and emergencies, others are routine and preventative care. So it just depends on what kind of setting you're working in, that that's what it will determine your kind of day. Nurses typically, you work as a healthcare team who diagnose and treat patients in various settings. So a day in the life of a nurse can and will include a wide range of duties depending on the specialty and setting you're in. Some of these most common responsibilities are triaging patients, taking measurements, taking vitals, performing assessments, drawing blood or conducting different tests, contacting physicians when patients have changes and letting them know, because you are really the eyes and the ears of the doctor. So you have to continue keeping maintaining accurate records. Patient education is so important. And I think that this is the number one thing that nurses have to up their game in, because really this is how the patient, if you educate your patient correctly, they're going to go home and they're going to better manage their conditions. And I get sad about this because I feel like there's a lack of education and proper education towards patients. So also you're there to provide emotional support to your patient and their families. You implement and assess care plans. And then you also share relevant patient information with oncoming staff, case managers, physical therapists, doctors, you're part of a whole interdisciplinary team, and you are the one that communicates about your patient to these oncoming different teams that come in. You also set up treatment rooms, you sanitize, you troubleshoot, you're like the electrician, you clean, you do a wide range of things, performing wound care. There's just so much in nursing, and I think that that's the beauty of nursing, that there's just so much to do. You can just, like Michelle said, you can either do administration or you can do bedside. For me, bedside is what I like the most because I like interacting with the patients directly, but there's just so much you can do in nursing, and that's why I think it's so beautiful. Thank you.
Awesome. Thank you, Cecilia and Michelle, for your presentation. Again, my name is Rebecca Mortimer, and I'm going to be covering the topics on work-life balance and also some tips that I believe will be useful for aspiring nurses. So as we know, if you don't know already, the nursing profession does require a lot out of you. It's a very demanding profession, but like Cecilia mentioned, it is highly, highly rewarding. However, a lot of nurses tend to get in it for the wrong reasons, either for, financial stability, which is a great aspect to it. But if you don't really go into nursing with the right mindset, the likelihood of you staying in the profession is probably slim to none, just to be quite honest with you. So it's very, very, very important that when you get into the profession, you try and balance yourself as much as you can, because as I stated earlier, it is a very demanding profession. And balance just means just trying to have some sort of harmony between your work life and your personal life. And that could be different for everyone. So I would definitely suggest to find something that you love to do outside of nursing. One of the things that I often say to my clients, and that's because I'm also a millennial mindset coach, is to find something that you love to do, find your purpose. I think when we get into our profession, sometimes the things that we really love to do takes a back seat, and we don't really know how to juggle and maintain the two. And for me, that was one of my struggles, because I love the profession that I'm in. And if I had to do it again, I would still choose nursing. However, I truly believe that there is a difference between your profession and your passion. So I would encourage those who are pursuing nursing to find what your purpose is. It's great to work in a profession that's highly respected, but at the same time, you don't want to lose yourself. So make some time for yourself. That can include self-care. On your day off, make sure you do something that makes you happy. Make sure you do something that makes you feel relaxed, something that allows you to just be able to, just to stay in tune with yourself. For me, that's spending quality time with my family. That's one of the biggest things for me. For someone else, it may be exercising or doing something that they love doing, rollerblading, jogging, running, whatever the case is. Find something that you love to do so that it's not all just about work, because when you're at work, you are working, right? So when you're not at work, you want to make sure that you're taking some time off for yourself. Go and get a massage or join an organization, do something that makes you happy, right? Another thing that can help you balance your life as a nurse is living a healthier lifestyle. You know, like I said, nursing takes a lot out of us, and it's so important that we maintain ourselves and our health so that we're able to help others. I often say you're not able to pour into someone from an empty cup. You can't help someone get through whatever they're going through if you yourself are empty. So make sure that you're getting the proper diet and exercise in and staying on top of your health so that you're able to, function at your most optimal level. Another suggestion I would give is, let's see, time management, right? Make sure you're budgeting your time so that you're able to make times for the things that you want to do outside of working. And that could look different for everyone, but it's really important that you identify those areas that makes you happy, and make sure you make that a highlight. Again, if we look at the rates, of nurses leaving the profession, it's because of burnout. They get burnt out, they feel overworked, they feel like they're underappreciated. You get to work, it's short staff, there's not a lot of staff, so you're having to pick up the slack for what's not there, for the deficit. So again, be vocal about those things, but at the same time, always put yourself first, because if you yourself are not happy, it's going to be hard for you to enjoy what you're doing as a nurse. Let's. Are we able to go to the next slide? Actually, go back to the previous slide. I was going based on my notes. Want to make sure I touched on everything. Okay, you can go ahead and move over to the next slide. All right, so advice for aspiring nurses. So some of the things that I want to touch on as far as giving advice for those who are wanting to pursue this amazing profession is to work on your communication skills. Communication is very, very big, and it's key, especially for being a nurse, because you're going to have to communicate to your team members. You're going to have to communicate to physicians. You will have to communicate to your patients. And that's a strong skill set that you just want to make sure that you have. Especially when you're working with patients who might be critical, you want to be on top of those things, because you want to be able to communicate these things to whomever it's necessary. Gain experience. One of the things I did before I became a nurse was I used to volunteer at a hospital. So I used to take a couple of hours out of my day, and I would just go and volunteer. And volunteering looked like passing out water and ice to patients. But for me, that little bit of experience, although I wasn't doing much, I wasn't seeing patients directly, I wasn't providing direct patient care in any way, but just being in that environment of a hospital just really allowed me to see how things run and how things operate. Because sometimes you see things on the TV or you hear about certain things, but you don't really know what it's like until you're actually experiencing that for yourself. So when I actually volunteered, it was me actually being able to experience what it looks like to actually be in a hospital, because I knew that I wanted to work in a hospital someday. And so having that experience was everything for me. And so when I actually did start working in the hospital, those things started, I started connecting the dots, and it started to become familiar to me, because it's like, okay, I've done this already. So definitely try to expose yourself as much as you can, whether that's volunteering or maybe working as a secretary on the unit. I also, while I was in nursing school, I was a CNA. My last 2 semesters prior to graduating, I did work in the hospital as a CNA because I wanted to get my foot in the door. This was over 10 years ago, so things might be different. But back, 10 years ago, it was kind of hard to land a job as a new grad in the hospital. So I didn't want to have to go through that, because I've heard a lot of people struggle with trying to get in. And it was just much different than what it is now, because I know they have a lot of programs now for new grads that kind of help train them and transition into their role. But back then there were not too many of those programs. So I worked as a CNA for a year, and that also helped me because I was able to shadow certain nurses and just kind of get a view of what they were doing, asking questions for things that I needed clarity on. I would mess around with IV pumps that were not used, obviously, but I was just gaining that exposure. So when I actually started working on the unit, the same unit that I was a CNA on, I worked on that same unit as a medical surgical nurse. It was familiar for me. So the transition wasn't so bad because, that's obviously two different roles, but at least just being in that environment really, really helped me. So if I would stress, if you can, try and get into a hospital or whatever unit you're wanting to work on, because it's not just a hospital. You have clinic settings, you have outpatient settings. So it all depends on what you're trying to do, but definitely try and get some exposure that way. Another thing I would suggest for aspiring nurses is to find a nurse mentor. I absolutely highly believe that finding a mentor, having a mentor is um, definitely something that will be beneficial to you, because the nursing profession, if you don't, it can be lonely, especially if you don't have the right people in your corner. I'm sure, or maybe not, you've heard of the phrase, nurses eat their young. And it's unfortunate. And that's one of the reasons why I created the platform that I mentioned earlier, Executive Nurses League, because we know what it's like for nurses, especially new nurses, to feel like they don't have a voice, or to feel like no one's really standing up for them, or to feel like they can't speak up when something's happening, or they're being bullied by other staff members, right? Having a mentor can kind of help you, just kind of assist you with making that transition a lot smoother. For me, I had a mentor. At the time, it wasn't an official mentor, but now that I look back, I think to myself, okay, that person was definitely a role model for me. I would ask her questions before I became a nurse. I would ask her, how do I study for my boards? Or what is it like working on the floor? And just having someone that you're able to confide in, that's already in your profession, makes a world of a difference. You want to connect with people who are already where you want to be. If you're aspiring to become, an OR nurse, try and connect with an OR nurse. There's so many different routes that we can take nowadays where you don't have to meet in person. You can probably look for different groups or forums on Facebook, different other social media platforms that will allow you to connect. Do that. Try to find someone that you're able to trust, to ask questions, to kind of give you the rope and the inside scoop on what it's like to be in this profession. In addition to that, I would say ask questions. As an aspiring nurse, as a new grad nurse, even as an expert nurse, you're always learning. You never stop learning. So you want to make sure that you stay up to date with the latest research, with evidence-based practice. You want to make sure that you're staying up to date with your continuing education. Ask questions on your unit if you don't understand something. If you go through orientation and something's not clear to you, ask questions. Use your chain of command to make sure that your questions are being addressed. Even while in nursing school, make it a habit to ask questions, because what you don't want to happen is you get on the floor and you start working, and you find yourself in a situation where you feel like you need clarity, or you don't understand a doctor's order and you're not speaking up, because now you are compromising patient safety just because of not feeling comfortable to ask. It could be something as simple as just asking someone to clarify something. So when in doubt, always ask questions. There's no such thing as a stupid question. I know that's cliche, but honestly, if you want to practice safely, you're going to have to learn to be just open in that sense of asking questions for those areas that you need clarity on. Um, Also, show initiative. Show initiative. Show that you're willing to, work an extra shift if you are that person who likes to do overtime, or show initiative with helping out a coworker or helping out a classmate if you're in nursing school. Take initiative, because our profession is you have to be pretty flexible and you have to be able to adapt. And because things can change at any given moment. And I truly believe that, you know, when you show initiative, you show your love for the passion, and it just makes you a better team player overall. Because no one wants to work with someone who's not willing to assist or not willing to help, especially when things are going on. You have to be willing to work with people, because it really does take a group effort for us to be able to make sure that our patients get the best care that they absolutely need. And again, speak up. I touched on this, and I believe one of the other presenters touched on speaking up too. Speak up, especially when you see something's not right. Speak up. If you see something's not right with your patient, speak up. You know, it may be that could be, you know, it could be a matter of life and death just by you speaking up and saying something. You want to make sure that, you know, you do speak up, and don't be afraid of the retaliation that may come with it, because back to what I mentioned earlier with nurse bullying or nurses eating their young, oftentimes new nurses don't really have a voice, and they feel like they don't have a safe place to really open up and to speak on the issues that they're going through. But again, it goes back to finding someone that you can confide in, that you're able to share. You know, what you're going through with, so that you can make sure that you're operating at your best level, whether that's speaking with management, someone that you, a coworker that you trust, or a nursing student that you trust, wherever that is for you. Because I'm not sure where everyone is as far as being in nursing school, or maybe already being a nurse. I'm not sure where everyone is, but definitely use these tips that, you know, we were able to provide you, because at the end of the day, you want to make sure that you're practicing at your highest level. And I'm excited that I was able to come on this platform with you guys and share that information. I'm going to go ahead and pass it over to, I believe that was the last slide. Are we going into questions now?
Yes, thank you so much everyone for sharing. Now it's time for our live Q&A session, so you guys can type your questions in the chat and our panelists can answer any questions that you may have. All right, I got a message. Someone said, how do nurses deal with deaths and griefs? That's been my biggest fear.
I think, you know, everyone handles death differently. And unfortunately, there's not one same answer for everyone. But it goes back to what Cecilia and Rebecca was talking about, which is really that self-care. So however you may handle the news, well, first and foremost, you know, you definitely want to be there for the family. So it does take some learning to kind of internalize the news initially first, um, just so, because you know you have to put on kind of like a brave face for the family, but the feelings and the emotions that you have later on, you definitely want to make sure that you address it, either through, you know, having a great support system, having fellow nurses, talking to friends, doing some self-care, and basically going through that grief process yourself as well. Because if you don't go through that grief process, if you kind of just brush it off, and just internalize it, after a while it will take a toll on you. And again, that's typically how burnt out is caused, because you're just internalizing, you know, these negative emotions.
Thank you. Someone else asked, what can I do right now as a junior in high school?
I think like as a junior in high school, you can start exploring different programs, mentorship programs, or even nursing associations in your state. A lot of them have nursing mentorship for high school students. So I think that's a good start. Or talk to your counselor. They might have programs that can give you some mentorship during your high school years.
Mm-hmm.
Awesome. Someone else asked, when you guys were in nursing school on average, how many hours did you guys study each day?
I studied a lot, a lot. Um, before I give you an hour, I just want to say, nursing school is very different. For me, when I was in high school and even, when I was doing my prereqs, I was the type of student that I was your straight A student. I would, get 4.0s and everything. My first 2 weeks of nursing school, I remember I had a breakdown because it was so different from what I was used to. Typically when you're doing your prereqs, you go to school or you go to class for 1 hour every day, or like 2, 3 hours, 2 to 3 times a week. And for the most part, the professor or the instructor will cover most of the material. Nursing school, that's very different. Your first semester in there, you have, your foundation, you have your communication, you have all these classes in addition to lab. And typically for my program, I would have like 40 chapters I would have to read every single week. And most of the time, my instructors weren't able to cover everything. So there was a lot of self study. And so I would say I would spend on average, like maybe 3 to 4 hours or so just, studying, reading the material. For me, I'm an auditory learner. And so I listened to a lot of, instruction videos. That was just a way that I was able to comprehend all of that information a lot more easier. And yeah, and back to my point that I forgot to make initially was that when you're in nursing school, you're basically you're in the same class as like the top 5%. So all of these students are all straight A students. These students are the ones that made it into the nursing program. So the material will be more difficult than what you're used to. And that's when you're really going to need to use your support system. But in terms of like how many hours of studying I did a day, I would say probably anywhere from like 2 to 4 hours. And I do try to make sure that I have one day where I'm not studying, and that's my self-care day where I can just relax and breathe. Because if I'm studying every day, like I would just get overwhelmed, and that's just not how I would be able to process new information easily.
Sweet. Someone else asked, what if you're looking at nursing and you're full of doubts? I've been looking into nursing for college, but there's a part of me that's worried about it. Does that mean it's not for me?
So I'll go ahead and answer that question, Gia, only because I was exactly where you were, because I remember after high school, I entertained the idea of wanting to become a nurse, but I also struggled with self-doubt, not really believing that I could do it. I struggled with the idea of, okay, is this really for me? Can I do it? You hear about all of these horror stories with nursing school, people not making it out, and how much of a toll it takes on your life. And I wasn't afraid of working hard, but it was just the idea of feeling like I didn't have what it would take to become a nurse, right? But it took for me to really, and I remember, because I was not I'm gonna be completely honest with you. I wasn't the student who was like gung ho when I was in high school. I was a part of the band, so I was a part of other extracurricular activities that occupied my time. So when I went into college, my first few years, my study habits were not the best at all, right? And so I would remember taking certain classes, and I was struggling in those classes. And because I was struggling, I had poor study habits. It was hard for me to move forward. And I remember after failing a class, I really had to do some self-assessment. And I remember going home and just telling myself, okay, this is going to be the last time, because if you say you want to be a nurse, you have to actually, be willing to put in the effort to get into the program. And so I remember just telling myself, looking myself in the mirror and just telling myself, I am going to get into a nursing program. And at that moment, my mindset completely shifted. And I started telling myself that I could do it. I started telling myself that I do have what it takes. Because oftentimes when you're doubting yourself, you feel like it's not meant for you, but it's only because of the doubt. So if you learn to just get over your fear, get over the doubt, get over the insecurity, that's more than likely stems from something else. Chances are you are going to thrive in the profession. And like I said, I'm coming from somebody who doubted myself, doubted if I could become a nurse, and now I'm a board certified family nurse practitioner. So Gia, Put away the doubt, put away the fear, and just take a leap of faith and just do it. You got this.
Awesome. Someone else asked, what were some important classes you took in high school?
I think that, it's important to pay attention to all your classes in high school, but there's not necessarily a class that's going to cater to your nursing profession. This is more classes that you start taking once you enter college for your prereqs. I don't know if the other panelists have an opinion on that one.
I think, maybe keep focusing a little bit on like your science classes, because just with the prereqs that are required to get into nursing programs, they're looking at, like your chemistry and your biology. So do pay attention, and focus a little bit more, I would say, in those types of classes.
Cool. Reagan asked, in order to specialize in a certain area of nursing like pediatrics or critical care, do you have to do special training? If so, how long are the programs?
So to answer your question, Reagan, so everyone has to do their general curriculum in nursing, whether that's your associates or your bachelor's. So you're going to come out with a degree in order to practice. Now, in order to get into those specialties, more than likely they'll have some type of program at the hospital that will allow you to get a training in order to be able to go into those specialties. So you just have to, once you get that general degree in nursing and once you pass your state board, some, I'm not sure how they do it now, but some, hospitals would require that you have, your basic 1 year of experience on a med surg floor, since that's considered to be the bread and butter of nursing. But it may be different now. You may be able to go right into a specialty, but you will have to go through some level of training to get into an actual specialty.
I think also too, if you're interested in, like critical care or peds or something like that, typically at the end of your, towards the last quarter or semester of your nursing program, you'll have kind of like this free rotation option that you can do where you can choose what type of unit you want to get into. And a lot of times people, for their, senior curriculum, they'll choose to go and, do some work like on the pediatric unit, or like work in critical care for example, kind of just to get that experience to make sure that that's what they want to do.
All right. Someone asked, did you have to sacrifice your social life in any way?
Absolutely. But yes, nursing school, is that in reference to nursing school or just as a nurse? Because if I can be completely honest, if it's regarding nursing school, yes, because it's going to take a lot of your time. I'm just going to be completely honest with you. You're going to have to dedicate and devote a lot of your time to study, because the material is, first of all, it's important material that you need to understand and not just go based off of memorization. You need to be able to understand what you're doing, and that's going to require time. And you're going to have exams that you need to prepare for. So you may not always be able to go out to dinner with your friends or go out to, a party. You're going to have to cut back on some of those things. And if it's something that you really want to do, then you're going to have that discipline to know when to say, no, I got to stay in and study. It is what it is. It's one of those things that you're just going to have to sacrifice. But it's a temporary sacrifice for a long-term gain. That's how I see it.
Everything worthwhile takes a little bit of sacrifice, I think.
Right.
Mhm.
Absolutely agree.
Let's see. Someone else asked, are there any other barriers you came across before your nursing career, like in school?
Yeah, I think for me, it was really just the initial shock of how different the nursing program was, compared to, classes that I took before in the past. And then, once you do your rotation, for me anyways, I remember sometimes I had something called imposter syndrome where, you feel like you don't really belong. First off, everyone has that feeling. Everyone feels that way, whether, they're done with nursing school, and you might feel that way, your first couple of years. And again, that kind of ties with the self-doubt. But really just taking it day by day. Take big deep breaths, ask questions when you're not sure, and really just finding that support group. Like, I'm really big about having support. I think, nursing is so tremendous, but there are a lot to it. And sometimes if you just internalize all of that feeling, it's going to eat at you. So just making sure that you have support.
All right. Gia asked, what helped you guys memorize? I've been getting anatomy and physiology books to help me learn, but nothing seems to sticking well. Got any tips?
I think, like, when I was teaching clinicals, I would tell students that it really benefits to buy a pathophysiology book. It's really, interesting to read and understand how the whole system works. And it tells you, like, down to the cell. It might be too much information, but I think it really breaks it down to where you can really understand the systems.
Yeah, and I would recommend like a study group as well. One of the best ways to learn things is learn it as if you were going to teach it to someone else. And if you're able to form a group and you guys can just review with each other, bounce ideas and tips off of each other, that would be really helpful too.
Awesome. Someone else asked, what programs helped you on your track on nursing?
I'm not quite sure I understand that question.
Yeah, in terms of books or.
I'm not sure either. So Janet, I'm sorry if I pronounced your name wrong. Would you like to elaborate a bit more?
High school programs that make you go to the direct nursing route. So like science programs or like college programs. Or even
I think that would vary depending on what school you're going to, because I don't think there's a general program. I would recommend that you maybe speak with an advisor and ask them if there is a program that is centered around nursing that you could probably take advantage of. And maybe do some research to see if there's anything locally in your area, or maybe if there's a hospital offering a program to aspiring nurses. That would probably be something that you probably have to research in your area. I don't know any off the top of my head.
All right, we have one more question, and this will be the last one because we are running out of time. So Gia asked, so my ultimate goal is to be a nurse for the Air Force. Do any of you know the difference of the atmosphere if anyone has served?
I haven't served, but I actually have two girlfriends who are in the Air Force that are nurses there. And one of the nice things about it is that they actually help pay back their loans. But I don't have any direct experience with that. So I unfortunately can't really give you an answer.
Awesome. That is it, guys. Thank you so much for attending our conference. I really hope you guys enjoyed it. Make sure to follow us on all social media platforms to learn about our upcoming conferences and events. And we recently launched a podcast, and it's called Aspiring Doctors, and it's available on Spotify. So if you're interested, definitely check that out. And that's pretty much it. So thank you guys so much for joining. Have a great rest of your day.
Thank you.
Oh,
Thank
Bye.
you. Bye, guys.